Hello, this is Dr. Michael Shear with Learn Locator, a free resource on how to treatment plan, utilize, and maintain locator attachments for overdentures. This video is going to be describing the prosthetic conversion of this complete denture into a fixed immediate load hybrid restoration, also known as an all-on-4 fixed immediate bridge. We're going to be describing some clinical techniques utilizing the Zest Anchor's CHAIRSIDE product line, including the products you're already familiar with, the attachment processing material and the denture prep and polish kit, and a couple of new products available from Zest Anchors, the CHAIRSIDE bite registration material, as well as the extended range or the extra large 18 milliliter CHAIRSIDE attachment processing material. The purpose is to describe taking this complete denture and utilizing these materials to create holes within the complete denture and attach it to this implant restoration. So looking at the new products available from Zest Anchors, we have on my left-hand side of the screen the Zest CHAIRSIDE Attachment Processing Material, and on the right side the Zest CHAIRSIDE Bite Registration Material. Inside of our box, as we open up our CHAIRSIDE, we see here that we have 10 mixing tips that are designed for the 18 milliliter Zest CHAIRSIDE Attachment Processing Resin. What's really exciting about this new particular design of this really award-winning resin that's utilized for picking up implant overdentures is you can utilize it for fixed restorations like we're going to be demonstrating in this video. Because it's designed to fit on a standard PVS style cartridge gun, like you see here, snapping it into place, it should feel very natural to you, just like you would be utilizing a light body or injection style PVS. When removing the cap, we can bleed a little bit and attach a new tip. Pulling out one of the mixing tips. They're designed for efficiency as well as optimization of the material. As you can see here, it has a thin mixing tip, so we're not wasteful, and it also has a very precise applicator tip. So when I start mixing that material, it comes out in a very nice aesthetic pink color, as you see right here. Now as we kind of shift our focus towards the bite registration material, as you see here, the bite registration material is a brand new product from Zest Anchors, utilizing a very similar feel of what you see existing on the market right now, but improving it and utilizing it specifically to help with CHAIRSIDE conversion of either a locator overdenture case or a fixed all-on-4 or DIEM style case. Additionally, you can certainly utilize it for your crown and bridge dentistry or for your other procedures involved with complete dentures to make a bite registration. Included is a series of mixing tips, 5 of them. And also, you get 6 of them in a cartridge. I've already pulled one out. 2 large 50 milliliter cartridges. And if we put that to the side, we can see here that we have a standard PVS style injection mixing system. And if I remove that, again, very similar to the attachment processing material, I can bleed a little bit out, attach a mixing tip, and it works very effectively, just like what you're used to working with. This material is also trimmable, so that way when we move on to our next step of either our overdenture or our fixed immediate load restoration, it makes for very easy processing. Now that we've zoomed in, it gives you a chance to see that we have 4 implants properly placed on this maxillary arch. This demonstration is showing you Nobel Biocare active implants with multi-unit abutments on these 4 implants. This is to simulate getting to the point where my surgeon has finished the surgery and it is ready for the prosthetic conversion, converting the complete denture into a fixed immediate load all-on-4 restoration. So the comfort caps or the healing abutments are in place. We have our maxillary complete denture that's been pre-planned. It's essentially still an immediate denture at this point, and we're going to be converting it into a fixed immediate load restoration. Step number 1 is as we take our Zest CHAIRSIDE bite registration material and we inject it into the complete denture. into the areas corresponding with the implant position. And seating it onto the edentulous arch, trying to seat the palate as much as possible. What you're going to notice is that it's not really going to be seating all the way because our healing abutments are pretty tall. After approximately 1 minute, we let that sit and I come back and remove the denture. Okay. Now we've separated from the implants. We see here that we've got these 4 indentations on the inside part of the bite registration material. This is giving us the approximate position of where the healing caps are. Now we can set our patient to the side for now. We're going to be taking out our denture prep and polish kit. Inside of our denture prep and polish kit, I personally like to use the grind burr for the initial part of the procedure because it trims very nice and very easily through the bite registration material. We're going to go ahead and we're going to activate our grind burr until we create a little hole. Same thing here for our front implants. Notice how the bite registration material from the CHAIRSIDE product line is very easy to trim using the grind burr. Now what you can do, one of 2 things, is you can either start to go all the way through the complete denture with the bite registration material in place, or you can remove that and inspect where your holes are and then make corrections from there. Now here's what my complete denture looks like now that I've done my initial grind burr holes. If I take that and reseat it back on the model, those holes should correspond approximately with where my healing abutments are positioned, as you see right here and right in here. Now I'm going to go ahead and continue drilling until I'm all the way through the denture. And now I've punched through the palatal portion of the complete denture using my grind burr. And I'm going to continue to do the same on the other side, as you see here and as you see here. Now one nice thing that you can also do is using the denture prep and polish kit, you can put your grind burr back and you can take out your recess burr. It's pretty exciting because when you look at the size of the recess burr, it actually corresponds pretty well with the size that you'll need for the temporary cylinder, as you see here. It also cuts very effectively and nice and fast without a lot of clogging. As you see right here. Perfect. And the same thing here. Now once that's been completed, we can see here we have 4 holes and we're ready to try that back on our denture. Now it looks like I've put one of those holes a little bit palatal than the other, but don't worry about that. As I hold the denture up into position, see here how it nicely shows that healing abutment in the center and then also right over on this side. As I enlarge that, continuing around, if I use my recess burr on my pre-prepared holes, it usually drops right into place. Seating it back onto my denture, you see now I can see my healing abutment straight through. And on my last hole. Now we have our denture with our 4 holes. Still we have our ComfortCat healing abutment still in place. I'm going to seat my denture back on just to kind of give me an idea of how close I am. Pretty darn close. As with any sort of pickup procedure, like you've seen on other videos, you know that when you take your bite registration material and you seat it on, a lot of times your posterior two implants also create a little arc where you have to then make a correction with your posterior implants, like I see on this side, not as much over here. Part of the reason is you can see the height of our multi-unit abutment on this right side versus here, or the patient's left, patient's right. Now at this point, a lot of times will recommend grabbing one additional burr, and I like to use one that with a little bit more of a cylinder, which is not available in the prep and polish kit, but you can very easily get with your existing burrs. I'm going to take that and start trimming on the back side of here, and also coming from this direction. Clinically, what we would do is our next step is to remove the healing abutments and then to place on top of that our standard temporary cylinders. I'm going to take my Nobel hand instrument and manual insertion removal tool, take away that, my first temporary cylinder onto my patient's multi-unit abutment. This is giving you an approximation of where the next step occurs. As you see here, that cylinder is starting to come out right through the center of that hole. As I continue on, I can remove the rest of my healing abutments. Now I can go ahead and assemble the rest of my temporary titanium cylinders onto my patient. One at a time. Inside of the titanium temporary cylinders is the prosthetic screw from Nobel Biocare. It is a black colored screw. If you have the silver colored screw, that's meant for the laboratory portion. Some clinicians also like to use the longer guide screw at this point. I prefer this technique. Now as the denture goes on top, you'll see that we have our 4 temporary cylinders coming out the occlusal holes marked by my CHAIRSIDE bite registration material, as well as using my locator recess burr to create my holes. One thing you'll see also on this model is that the denture sits down pretty flush and even. Since it's a demonstration model as courtesy by Nobel Biocare, I thank them for letting me use this model. However, the denture, you'll notice, it doesn't fit exactly with the palate. On your patient, you'll typically see this fitting flush with the palate. If it doesn't fit flush with the palate, it generally means that your denture is not down all the way. So I'm going to go ahead and I'm going to enlarge my hole just a little bit more on this side and on this side and a little bit right in here. And I like to use just a standard cylindrical burr to do so. Now trying my denture on here, we can see that all 4 of my temporary cylinders are clearing the denture. I can verify that the denture is fully in contact with the soft tissue, and you can many times have the patient bite down and check your denture seat that way as well. One thing you'll notice is that if you have a high cylinder in a place where you do have occlusion, many times you do want to trim that down, as you see here. So I take a standard Sharpie, or you can take a sterile pencil, marking type colored pencil you would use in a surgical situation, and you would mark the side corresponding the positions where you would want to trim them. I know that I don't have to worry about these 2 cylinders because my patient is biting right here and right here. However, if you have the patient closed down, you can also verify if those are touching or not. Same thing over in here. I'm going to trim that one down a little bit. And in an ideal world, we would potentially want to trim down right here and right here as well. I'm going to go ahead and demonstrate the trimming of that. So once I've gone ahead and I've marked the position of my temporary cylinders where I wanted to trim, as shown by my Sharpie markers, I can go ahead and clinically remove the cylinders from the mouth and take them to the laboratory and trim them in there. You never want to trim these cylinders in the mouth because you're going to be generating significant amount of heat to the implant and also a potential risk of sparking in the mouth. So I take a standard multi-unit abutment analog, and I apply my temporary cylinder to that, right in here, showing you the Sharpie marker. There. I remove my driver and I just grab a simple needle holder or forceps, click it together, and find a very stable position where to sit. As I zoom in a little bit, it'll show you how I'm going to modify this. I take a standard Joe Dandy style disc or alloy trimming discs, and making sure that I'm wearing eye protection, I'm going to verify that I can trim this in the exact position of where that marker is. Holding very steady, you're going to start to see some sparks. Being very careful, because you're going to notice that this is going to become very hot. Occasionally it will come loose, and retighten as necessary. And that's our separation. Sometimes I'll take this instrument just to feather it around as I do that, just to remove some of my sharp shards. Or you can take like a cleoid discoid and just kind of feather out some of that sharpness on the inside of that. And you'll notice that you can also do this with the standard high-speed handpiece if you have that available during the surgery. However, many times the surgical conversion into a fixed all-on-4 is done at the surgeon's office, and there many times will not be a high-speed handpiece there. When that has cooled down, I can take that back to my patient, reattach it, and see the change that I have had. And that's pretty ideal of where my cylinder is in position. So I'm going to continue and trim these additional 3 cylinders, and then I'll show you when we're done. Now, as we see here, we have our final appearance of our trimmed temporary cylinders properly in place and sized according to what we would ideally like to see inside of the mouth. Just a reminder that we have not trimmed these in the mouth, they were trimmed in the laboratory. When I take my patient's complete denture, now that I've trimmed the holes in it, I'm going to seat my denture on the top. I'm going to notice that my cylinders are coming roughly through the center of the complete denture holes that we've created with the grind and the recess burrs. I'm ensuring that my denture is seating evenly on the soft tissue, and I can verify that I have the proper orientation of the complete denture by having the patient closing into centric while they're wearing this complete denture. These temporary cylinders should be at or slightly below the plane of the existing denture acrylic resin. One thing you'll notice on my model is that it's not touching the hard palate because it's a demonstration model. They wanted to make it nice and simple. However, in the mouth, your patient's complete denture should be touching the palate intimately. There's some people advocating a technique where you don't have the patient bite down when doing the conversion. They just hold the hard palate like so. That's a pretty repeatable technique. However, I really like to ensure that the patient is occluding properly on both sides to seat the prosthesis all the way. And this is distinctly different from the locator technique, where I always advocate finger pressure holding the denture into place and then adjusting the occlusion later. The way that I have found success in my clinical practice is I have the patient bite down into centric while holding the prosthesis in place and the resin, the attachment processing material hardening, and then I can back away from the patient and say, oh, is my aesthetic line in the correct orientation as the patient's pupillary line, verifying all of those features are in place instead of just arbitrarily holding it and then viewing from different angles. 2 different techniques, both are sufficient for utilizing this technique. However, which you choose to do is solely up to your discretion. So now we know that the complete denture is intimately fitting and my cylinders have been properly sized. I need to verify that I'm not going to risk locking in any of my attachment processing material into my temporary cylinders. What I'm going to do is I'm going to take a rubber dam. The rubber dam has been pre-cut and pre-sized according to where I think my implants are going to be. So I'm going to take my rubber dam and start applying it over the top of my temporary cylinders. Perfect. Now this is in pretty ideal orientation. You're going to have a little bit of bunching of this material in different positions. I'm not too concerned about that. What I am concerned about is material coming underneath my implants and locking in my prosthesis as the resin sets. So I'm going to ensure that that's roughly flush with the tissue, so that way I can see I've got enough temporary cylinder for this to bind to, but yet not too much where it will lock in. As I take my complete denture and I seat it back on the top, it should have a very similar appearance as what I just showed you. However, now you can see I've got rubber dam showing through, and this is going to verify that I have my proper block out, ensuring that I don't have the risk I'm going to lock this denture into place. As I set that aside for a second, what I would advocate doing before attaching your temporary cylinders to your denture using the processing material, I'm going to take out my denture prep and polish kit, and I'm going to undercut some of the denture resin utilizing my undercut burr. Cleaning it off. And now you can see I've got undercut areas from my undercut burr. Keep in mind that the Zest CHAIRSIDE Attachment Processing Resin is not using any sort of primer, bonding agent, or anything, so that way this composite resin can properly bind to this denture resin. Mechanical undercuts are recommended. And some of you might say, well, I'm a little bit nervous about utilizing a composite resin with denture acrylic resin. I can tell you in my over a year of using the CHAIRSIDE processing material for conversions for all-on-4 immediate load bridge work, I have never had a temporary cylinder come loose or debond. And I do quite a few of immediate load restorations per month. And I can tell you that this resin is just magic in how it really grabs the acrylic resin of the complete denture. How I advocate utilizing this resin is just ensuring that I've got good mechanical locks inside of my access holes for my temporary cylinders, and then also ensuring that I have all of the resin clean and my temporary cylinders very dry prior to injecting my processing material. When you're ready to begin the conversion, what we need to do is go ahead and ensure that my screws are tight, and also that I have proper measures ensuring that I'm not going to get resin injected into my temporary cylinders. So I recommend and advocate utilizing little pieces of cotton. And these pieces of cotton are going to be plugged into your cylinders, ensuring that you have the ability to block out the little channel that's on the inside from the resin. I can reseat my complete denture and do one final quality control measure before I inject the resin. Prior to injecting the resin, I do advocate that you place some petroleum jelly on the teeth of your prosthesis and from the area of the resin right around any areas you don't want the attachment processing material to bind to. When I seat it back into the mouth is when you're ready to begin flowing in the attachment processing material. Now, as I said earlier, one of two methods is usually what is preferred by clinicians. Many clinicians like to advocate just holding the pallet in place while the material is injected, or you can have the patient bite down into place, or manipulate them into centriculation, because many times the patient will be sedated and not understand where their jaw position is. As a general rule, I like to have the patient bite down in my own practice, in my own hands when I do this procedure. Now, as we take our CHAIRSIDE Attachment Processing Resin, it's now loaded onto our PVS mixing syringe and gun. We have a brand new tip in place. This cartridge has been bled. I'm going to take my resin and start injecting from the intaglio surface, and I'll simulate like I'm in the mouth right now, trying to hold this as vertically as possible. You'll notice that the resin flows very easily. And just like so. And continuing on. As we're injecting, we can hold this syringe up vertically, and the resin very easily flows into all the recesses and deeper portions of our cylinders. I've ensured that my cylinders are extremely dry at this point, and I don't have the ability to have moisture contamination. My rubber dam is in place, and I'm going to have the patient close into centric or have the patient with firm palatal pressure. I can take this and also kind of manipulate it around and blend the resin in, so that way it makes my finishing procedure that much easier. And now what you can do, because it is the Zest CHAIRSIDE Attachment Processing Material, you can also accelerate the set of this material using a light cure. Since this material is a self-cure, you can either give it approximately 3.5 to 4 minutes on self-cure total working time, and in the mouth approximately 2.5 minutes, or you can hit the curing light approximately 20 seconds per attachment to enhance the set time. So now, after approximately 2.5 minutes to 3 minutes, we know that we have our temporary cylinders bonded to our hard CHAIRSIDE material. We can see here that if we take a little bit extra of the CHAIRSIDE Attachment Processing Resin and inject it out the side, it'll give us the opportunity to ensure that this material is hard before we try removing it. At this point, I'm going to zoom out just a little bit, so that way we can see our full, complete denture is now bonded to our temporary cylinders. As I take an explorer-like instrument, I can try to start removing some of my cotton. This can be somewhat cumbersome as we attempt to do that. What I really advocate is the use of something called a barbed broach. A barbed broach is essentially an endodontic file with more sharp little objects right here at the tip. Originally designed to remove pulpal remnants from the root canal, if you take this and spin this into place, it'll very easily remove the cotton. As we continue to do that, it makes cleanup work very simple. Now that the cotton has been cleaned out of our cylinders, we can then take an instrument and just verify that we don't have any resin over these holes, like I do right in here, just a tiny little bit. There we go. And then a tiny little bit right in here. No problem to clean up. Excellent. Taking a little air, we now have a pretty much straight access into removing these prosthetic screws. As I start, I'll usually start in the posterior, because those are the harder screws to remove. And you're going to hear that popping as the screw becomes loose. Many times it's very difficult to remove from inside of your cylinder while it's in the mouth. I usually just get them all loose and then try to remove it at the same time. The entire prosthesis, that is. And as you unscrew the last one, the whole bridge is going to start to become loose. And you can remove in one motion, keeping my fingers back behind here, lifting nice and carefully, simulating I'm in the patient's mouth. You don't want little tiny screws going down into the system. As we then take that, we inspect that we've got all 4 of our cylinders properly bonded, and I'm going to take my denture, just flip it upside down very easily. I'm going to see if I can get little screws to come out. Many times they will or they won't. You'll have to transfer those to the laboratory. This will give me a good opportunity to peel back my rubber dam, showing you how easy the conversion process works. And this, up to this point, is almost identical as what you've experienced on the Learn Locator side with locator attachments, or on the Learn Lode side with the locator overdenture implant system using locator. The only difference is that I've made a hole all the way through the denture, and instead of picking up a locator, I'm picking up temporary cylinders. So now that I'm in the laboratory setting, what I can do is be in a little bit more controlled of an environment. Step 1 is to remove all the screws existing from this denture. So first thing, I can remove the obvious screws. This was one from the patient's right side, pretty easy to remove. And I take that and we're going to put it into a nice cup to keep it nice and secure. What I like to do is I like to take from my denture prep and polish kit the grind burr. I'm going to go ahead and put it onto my handpiece. And I'm going to just use my grind burr on the top part of my cylinders, ensuring that I get a pathway of easy to utilize these cylinders. Taking a little air, I now should have a pretty good straight line access to remove my prosthetic screws. One thing I like to do in the laboratory is I like to use this WEHA T5 driver. This allows me to very easily remove prosthetic screws in a laboratory setting, as opposed to keeping things sterile the entire time. Removing one screw at a time, they should start to fly out. Okay, and one more. This one right here, still stuck in there. If I take the back end of a probe, it'll get to come out very easily. Now it's just simple finishing and polishing procedures, and then also a trimming procedure to convert this from a complete denture into an all-on-4 bridge. So step number 1 is to check the intaglio portion of the complete denture to see if there's any areas where I'm going to have to fill in some of my chairside resin. And it looks like there are a couple of spots. What I like to do is just take out some of my laboratory components available through Nobel BioCare. And these are these longer guide pin screws that I was telling you about earlier. If I slide that into my temporary cylinder, there we go, you'll see here, I can take a polishing protector, and a polishing protector will go onto my multi-unit abutment. And then I can use just my fingers to tighten it down, or I can use my T5 driver. What this will allow you to do is it'll allow you to add additional chairside attachment processing material to these corners, ensuring that you don't get that material down inside of your temporary titanium cylinder. This is the final appearance of our laboratory portion of when we can do our laboratory work surrounding this all-on-4 restoration now at this point. What I like to do is I could take some of my existing chairside in my larger 18 ml container, but personally what I like to do is I like to take my smaller 8 gram or 4 ml chairside attachment processing material, because it comes with this really nice precise applicator tip. As I do that, I can take some of this applicator tip and apply it to some of these very precise, deeper areas of my restoration. This gives you a lot more control. Now, once I've had that properly into place, I like to take just a simple brush-like instrument, as shown here, And I'll just take the brush and I'll just kind of brush it around. So that way the material drops down into those deeper portions, and I ensure that I don't have it covering the top portion of my polishing protector. Additionally, you can take just a simple explorer-like instrument just to make sure that I'm all the way filled with my resin, but also not filling the area above my polishing protector. The ideal final full arch fix restoration should have the long portion of the temporary cylinder still visible above the resin. Because it's chairside attachment processing material, I can also accelerate the set using a light cure and have this ready to be trimmed in approximately 20 seconds. This is distinctly different from what you would be experiencing using a standard acrylic resin. As many of us know, acrylic resin has an autopolymerizing feature that many times takes approximately 15 minutes for it to set every time you apply more material. Additionally, it needs to go into a pressure pot. If you don't use a pressure pot, you might have voids and porosity inside of your acrylic resin. The chairside attachment processing material is a composite resin that bonds to itself pretty easily without any additional primer or bonding agent. Because it's a composite resin, this curing light is a true set of my attachment processing material, making this conversion procedure significantly faster than what you would experience with acrylic resin. Now that I've completed that portion of the immediate load fixed bridge, I'm going to look at the occlusal portion to see if there's any areas here that I need to fill in. I don't see anything obvious, but I can take that same syringe, it's not yet set, and I could apply some additional material over the top and filling in any of these unaesthetic voided areas. With my guide pins in place, my laboratory component portion is very, very simple. As I take that and I start filling in some of those areas, you'll notice that my guide pin protects me from injecting this material any further into my temporary cylinder. Taking a brush, I can also feather this into place, getting it nice, aesthetic, and yet very, very clean. Also setting it with a light cure. 20 seconds per implant site is going to have this material trimmable almost immediately. Once my Zest processing material has been fully set, we can go ahead and start converting this into a full arch fixed hybrid instead of this complete denture. What we're going to do is we're going to go ahead and we're going to demonstrate how this prosthesis is going to look. The general idea is we're going to trim this back so that way all we have is this horseshoe portion of the fixed bridge work, and we're going to trim off a lot of this material on the back. Also here in the anterior, we're going to trim this back so that way it's more cleansable. Approximately like so. Several clinicians like to do this in a variety of different ways. Many advocate utilizing a disc or potentially a different style of disc to trim this resin. Me personally, I just like to use a fissured burr or some sort of acrylic burr and just start going to town. Additionally, what you can also utilize is your Zest trim burr to help you with this procedure. However, I find it most effective towards the end. As of right now, what I'm going to do is I'm going to use that same fissured burr like you saw earlier and just start trimming this off. Now at this point we've gone ahead and we've done our initial trim, clearing off some of this material around our existing bridge work. The bridge is starting to take shape at this point. What we need to do is we're going to go ahead and take out our trim burr. In the trim burr, we're going to start to go ahead and create some of those contours that we are looking for. So first and foremost, we're going to start trimming off the facial edge of this so that way it's not as much bulk around that facial portion, as well as some more of this rounded edge portion. Now, typically, you'll also trim back these cantilevers so that way they're as minimal as possible. And we're going to describe all of that. First step is we're going to take our trim burr, and you're going to notice how quickly this burr goes to work. So after we trim the facial edges of this now conversion prosthesis, we're going to go ahead and we're going to start taking off some of the back areas, making sure that I have as minimal cantilever as possible. Now, how we design these prostheses to be as cleansable yet as aesthetic and phonetically acceptable as possible, I try to leave the facial flange intact. The facial flange, if it's sealed properly, is going to ensure that the patient speaks normally, normal phonetics. But here on the lingual, I'm going to trim this back almost like a ramp, so that way that patient has the ability to get a toothbrush and or water pick back into those areas. Now we can see here our trimming progress is coming along. I've cleaned up a little bit just to make things look a little bit cleaner and neater. As we see here, we've got an implant provisional and full arch all-on-4 almost completed. We've used the grind burr, the trim burr, and some of the other prep burrs from the Zest denture prep and polish kit. At this point, what we've got is a pretty hygienic contour. We want the anterior portion of this flange of this all-on-4 temporary bridge to be in contact with the soft tissue. Where here on the paddle aspect, we want it slightly raised above the hard palate so that way the patient can take a water pick, keep this area clean during the healing process. Now at this point, we can go ahead and we can start to remove some of our temporary cylinders and verify that we've got everything cleaned up pretty nicely. This one cylinder is a little bit on the deep side, but as you see here, I don't really have any resin covering the edges of it, so that'll seat just fine. As I remove the second one, this would be a little bit more of an ideal type appearance, as we see here. Now across the board, I'm looking at some nice contours and finishing aspects of this temporary cylinder work. Sometimes what helps is we take a sharp instrument and we can go ahead and clean up some of this area right inside of here, like I'm going to do just with my cleoid discoid, just being careful not to damage the temporary cylinder. Same thing in here, just cleaning up some of that excess along in here, and just a little bit right in there. So across the board, that's a pretty nice finishing form. Minimal amount of fuss and mess when utilizing the Zest CHAIRSIDE Attachment Processing Material. So after verifying all of that, I can also start to trim some of these areas in this position on the occlusal aspect of my bridge work. Just taking my trim burr again without my cylinders in place, I can just start smoothing everything back so that way it's smooth to the patient's tongue. So we have our occlusal surfaces looking pretty nice at this point. What you can do is you can also go ahead and reapply some of your polishing protectors, taking this back to the rag wheel and using pumice to clean out some of these other areas right in here. Additionally, if you don't have a rag wheel that can get inside of these little nooks and crannies, I also like a rag wheel that goes on a brush, just like so, to allow that to be finishing procedures done correctly. What's nice about this is that with utilizing the CHAIRSIDE Attachment Processing Material, there's very minimal adjustment that needs to be done, including any of the polishing procedures needing to be done to the intaglio surface. Because this material sets up very nice, because it's a composite resin, you don't have to do a tremendous amount of finishing and polishing work to the actual CHAIRSIDE Attachment Processing Material. For the cameo or occlusal surface of our provisional, I'm going to take out my denture prep and polish kit, the polishing wheel. Now that your polishing burr has been utilized, you can start to see that the sheen is really starting to be picked up beautifully. Utilizing the Zest CHAIRSIDE Attachment Processing Material, in addition to utilizing the denture prep and polish kit, makes the conversion prosthesis and the laboratory work pretty quick and pretty efficient, pretty easy. I still like to take this to a rag wheel, so I'm going to go ahead and I'm going to apply my polishing protectors again and then polish it under a rag wheel prior to inserting in our patient. Now at this point, after polishing with the rag wheel, you can see the final bridge work really starting to come together. I still have on my polishing protectors just to show you the final contour as it should look after finishing using the rag wheel and the Zest Attachment Processing Material fine tip on the smaller syringe, or you could certainly use the larger syringe. Now I'm going to go ahead and I'm going to remove the polishing protectors and seat the bridge work back in my patient. So once I've removed all of the screws, you can see here again the final bridge work. As I take this back to my patient, I'm going to very carefully insert the bridge work back into place, inserting with the posterior 2 cylinders and then the anterior 2 cylinders. We should ensure that the bridge work is flush with the tissue as viewed from the facial. However, looking at it from the palatal, you'll see here that I've got nice access for the patient to be able to keep clean and keep food from out underneath during the healing transitional time period. Now, as the final screws and the assemblies get put back into place, I'll just bring to your attention the final finishing of the attachment processing material, both on the occlusal as well as on the intaglio. As I insert, I'm going to go ahead and start inserting one screw at a time, taking my final prosthetic screws, starting on the posterior, the harder to get to area. I'm going to insert and finger tight until I move on to the next screw. And our final screw. Ensuring that I have the final finishing contour just as you see right here. Facial gingiva, nice and flush. Lingual gingiva, palatal gingiva, open to access. As you see here, this is the final appearance of our final fixed all-on-4 bridge work. Combining the use of the Zest CHAIRSIDE denture prep and polish kit with the addition of one burr, as you saw in this demonstration video, the Zest CHAIRSIDE Attachment Processing Material in the 8-gram or 4 ml syringe, the brand new Zest CHAIRSIDE bite registration material, and the amazing Zest CHAIRSIDE 18 ml auto mix PVS gun syringe tip, specifically designed for all-on-4 or full arch fixed restorations. At this point, we can go ahead and we can torque our prosthetic screws into place depending upon the implant system that you decide to use. They're all differing torque values, and we can fill the occlusal access with whichever material you choose to use. However, this has been a demonstration video showing you all the Zest CHAIRSIDE product portfolio, how we basically took that from locator overdenture technology and Saturno overdenture technology and applied it towards full arch fixed all-on-4 restorations. I found a tremendous amount of success with this technique in my clinical practice, and I highly advocate you to try it for your patients. Thank you. This is Dr. Michael Shear with Learn Locator, a free resource on how to treatment plan, utilize, and maintain locator attachments for overdentures. I hope this YouTube video has been enjoyable. Stay tuned for further ones to come. Thank you.